Oh, welcome back. Thank you for coming back if it's the second time today. It is still Thursday the 30th of April. Now, Australia has been quite a success in this pandemic management. The strategy has been pretty good in Australia, even though the compliance of individuals in the population hasn't been as pleasing as you would sometimes expect. Although what you've got to bear in mind, of course, is the pictures that get onto the news tend to be the bad behaviour rather than the millions of people that are behaving well. So that's the cases, that's the deaths, 92 deaths. Now, because of the extensive testing in Australia, this case fatality rate could turn out to be fairly accurate. Again, expect more cases will be diagnosed than have been diagnosed already when we get more antibody testing. So I would expect that to go down to nearer 1. But it is giving a fairly accurate indication of the case fatality rate of this virus, looking about 1%. Now, what concerns me about that 1% figure is that if this pandemic carries on spreading around the world as it is at the moment, then that means that potentially 60 or 70 or even 80%, probably about 70% of the world's population could be infected by this virus at some point. And that's many billions of people. So we really hope that 1% of those don't end up dying, because that would give case fatality rates of 1% for huge numbers of people, and that's concerning. Now, this interested me a lot, and I must say I was somewhat surprised. I've been advocating this London University app, somewhere in London, not the university app, to monitor the cases in the UK, which have been good. But this is actually a coronavirus tracking app. Now, as far as I know, it's one of these apps like they use in South Korea, where the app monitors where you are. It knows where infected areas are, or even indeed infected individuals. And if you've come near them, it flags you up as being a high risk, so you need to self-quarantine. Now, more than 2 million people downloaded this app in the first 24 hours, according to Greg Hunt, the Australian Health Minister. So that is extremely encouraging. Now, I know what a lot of you feel about these apps, and I share the problem. Let me give you an example. And we're not a political broadcast, we know that, but let me give you an example of one that worries me. Turkey. The idea of an app that monitors all of the population in Turkey, to be quite honest, terrifies me. In Australia, I'm more than happy with it. I'm reasonably happy in my country, because I think the threats and the safeguards in my country kind of balance each other out. In Australia, I'm very happy with it. Australia's quite keen on civil liberties and things. So some countries it terrifies me. Other countries it doesn't frighten me at all. But yet I still see the efficacy of it, because we've seen it in South Korea. We've seen it in Taiwan. But interesting, this is completely voluntary. So more than 2 million have downloaded it now. So that means it's quite possible that, half the Australian population could download this. But even with 2 million, that's still a very good sized representative sample of the population of Australia as a whole. So that is going to give phenomenally useful information. And personally, I have trust in the Australian authorities. I don't think they'll abuse the data. So I would encourage Australians to do that, absolutely, and eradicate this virus from Australia would be the aim. And that's possible. That's possible. Now, this was encouraging as well. University of Queensland, COVID-19 vaccine has passed another important milestone, showing the ability to raise high levels of antibodies. So remember, antibodies are these protective proteins. So what happens is when someone becomes infected, their immune system recognises they've been infected and they make the antibodies, and it's the antibodies that get rid of the virus. So these antibodies can neutralise the virus. They will neutralise the virus. So what happens is you have the virus here with these spikes on it, these protein spikes on it. And it's these spikes that let the virus get into cells. So the antibodies kind of come and the antibodies stick to these the antibodies stick to these spikes like this. These Y-shaped molecules that stick to spikes like that. So they therefore neutralise the virus, so the virus can't get into the cells. So whether you've had the disease or whether you have a vaccine, it's still the antibodies that confer immunity. So it's extremely encouraging that high levels of antibodies that can neutralise the virus. Now, this is not in people, this is preclinical testing. But the fact that that works is very encouraging to me, because we're getting these antibodies, which is actually exactly what we need. And Professor Paul Young, who's in charge of the programme, said we were particularly pleased that the strength of the antibody response was even better than those observed samples from recovered patients. So what he's saying here was that the amount of antibodies generated by the vaccine were greater than the amount of antibodies generated by the actual virus itself in people who'd had the disease. So that is very encouraging, that there seems to be a strong antibody response from this Australian candidate vaccine. Now, of course, it will have to go on to trials in animals and humans, but it's looking like a strong contender. Now, the Oxford vaccine we looked at is a strong contender, and that might come earlier. But, you know, the more the merrier, it really is. It may turn out that the Oxford vaccine only gives short-term immunity, for example. I mean, we don't know. And it may be that this one gives immunity for 20 years. We don't know. So that's why we need different vaccines, so we can trial different vaccines and then get the most effective, the most effective vaccine out to the world there that needs it. Now, I'm going to go onto the United States now, but before we do that, I have to apologise for a bit of a hash-up yesterday. And I printed out these graphs because I think it shows it best. Where am I? There we go. I think it shows it best if we print it out. Now, what we have on these excellent graphs from the world in data. So we have the log number of cases up the side there, which we saw. And we have days since the 5th confirmed case. So that's when there started to be a problem along there. Now, what the world in data helpfully does is it gives us these lines. So that line there is doubling every 10 days. So that angle there would be doubling every 20 days. Whereas that angle there is doubling every 5 days. Now, I wrongly said, my apologies for this, that the United States, and this of course is the deaths here, the deaths were doubling every 3 or 4 days. Now, they are in that line, and they were, but it's the slope of that line that's important. So just there, so this line here is the United States. So there, that indeed was the case. But now, the increase in rate in the United States has levelled off. It's more kind of like that, because we have to line it up with the current things like that. And that gives us a line that's that kind of angle, which is doubling about every 25 days or something like that. And it's the same with the United Kingdom. So, in fact, the United Kingdom there, if we take it there, roughly it's going to be kind of there like that, which is even flatter. Now, Canada, slightly more concerning in Canada. Trying to be fair there, the line in Canada there does seem to be a bit steeper. So it looks like Canada deaths are still going up, perhaps more steeply than the United States and the United Kingdom. So it's the steepness of the line rather than where this line is positioned. So a bit of a schoolboy error from me there, really. So apologies for that. I've misled a few people. But do go into the world in data. Do put these graphs on. Put your own country in. They're quite fascinating. But the rate of increase is the angle of that line there. So in Canada, if we take the angle of that line there, then that's roughly kind of there. So in Canada, it's doubling roughly. If that's the every 10-day doubling line there, then in Canada, it's doubling every 12 days or 14 days or something like that. So sorry I misled a few people yesterday. That is the correct interpretation of these excellent graphics. And just to give one other example of countries we're going to be looking at. Now, again, this is a logarithmic scale. So it's 0 to 10, 10 to 100, 100 to 1,000, 1,000 to 10,000. So everyone's increasing times 10. And that, again, days since the 5th confirmed death. Now, Taiwan. Let's see if we can work out the line for Taiwan. Well, we obviously see it's completely flat. So in Taiwan, there is no increase in the death rate whatsoever. absolutely brilliant. Excellent in Taiwan. Now, New Zealand, you can see the death rate was increasing, wasn't it? There, because the angle was kind of there like that. So the death rate was increasing. So without interventions, New Zealand would have carried on going up. But because of the excellent interventions that have been taken, the New Zealand death rate is now also essentially flat. So there is no increase in deaths in New Zealand, which is excellent. But if we take Russia, we see the steepness of the line in Russia here. Remember, this is a logarithmic scale, of course. So in Russia, it was going up steeply there. So at one point there, the number of deaths in Russia was doubling about every 5 days. That's the 5-day angle there. So in Russia, it was probably doubling about every... In fact, no, it was more. It was near like every 4 days. It was doubling in Russia. Now it's eased off a bit. So if we took it from there, it'd be about every 6 or 7 days. The average kind of looks at about there to me from Russia at the moment. So unfortunately, that means the death rate in Russia is still doubling, perhaps about every 11 days or 10 days or something from that line. So that's the way to interpret those graphs. So apologies, I got that wrong yesterday. That is the way to interpret it. It's the steepness of the line that we always have to look at. It's the rate of change, and of course we offer great congratulations, and we're delighted with the people of Taiwan and the people of New Zealand, but we remain concerned for the people of Russia, especially of course because Russia's got such poor healthcare infrastructure. And to be quite honest, I'd be a bit reluctant to have a tracking app in Russia as well, as I would in Turkey. So there's no question that these political issues do feed into the way that the pandemic is managed, unfortunately. Now, this is interesting. The United States, again, the grim milestone of 1 million cases has been passed. The death rates, we've seen that the rate of increase in deaths in the United States is reduced, but of course the total number of deaths carries on increasing, even though at a lower rate. Although I am concerned about the reopening measures in the States that will increase cases. So if you're watching in the States or anywhere, as we've said earlier on, as we release the lockdown measures, there will be more cases, there will be more sick people, there will be more critical cases, and there will be more deaths. That's known. Now, someone very helpful... I do apologise, I can't remember your name, but it was a researcher in the United States, a PhD researcher. I asked about meat packing plants in the United States and Canada, where there's been an outbreak of cases in meat packing plants. And remember that the President of the United States ordered workers to go back to maintain food supply. Now, this is interesting. Now, I've included this as a specific example because there's so many things here that we can learn for everyone going back to work, for the whole thing, because there's some terrible mistakes being made in American in these meat packing plants. Now, first of all, many workers are Mexican or of ethnic minorities. Now, let's be quite clear about this. These people have darker coloured skins than white Americans. And in my view, that's an immunologically significant fact because they will make vitamin D more slowly. And I believe that lack of vitamin D is a major factor in reducing the competence of the immune system. Why more people don't realise that, I don't know. I've presented evidence for it numerous times. This is not my opinion. There is scientific evidence, but it seems to be a great blind spot that people have. I don't know. So many workers have dark coloured skin. And of course, by definition, they're working inside. So even when they get out in the sun for short periods of time, then they're going to make the vitamin D more slowly because they're dark coloured. Somalis, for example, apparently gravitate to this type of work. Now, Somalis have darker coloured skin than most African Americans, because all African Americans now aren't pure African anymore. There's been interbreeding, and the sexual abuse is well known, which we won't go into. But suffice it to say that African Americans are all part European, or part whatever American interbreeding took place. But Somalis are still quite black, many of them first generation, and they make vitamin D very slowly, especially if they live in Chicago or Seattle or Toronto or somewhere up in the north of Canada, even worse. Now, another thing, I don't know the details on this, but I've been informed that chemicals are used for processing meat in the USA and may affect respiratory health. Don't know about that, but if it's the case, it's bad news for worker health generally. Crowded conditions, people work elbow to elbow. That's got to change. We cannot work like this until we have a vaccine. So there's crowded conditions in the plants, and there's poor ventilation. Now, we've talked about ventilation repeatedly, and I believe people aren't wearing masks either. So if you've got one infected person on a production line who's breathing and coughing out, the virus is going to spread round about him. And the more crowded people are, the more crowded they are, the more people are going to breathe in his exhaled air and anything he's coughed or sneezed out. But even just anything he's breathed out. And if he's talking to the guy next door on the production line, the guy next door on the production line is going to get the virus as well from him just talking. But the better the area is ventilated, the more the virus is going to be blown away, and it will dilute the amount of virus in the air. Therefore, it will dilute the viral load. That will make people less likely to get it. And if they do get it, it probably makes their condition less severe as well. So these are poorly ventilated. All workplaces are going to need to be well ventilated, because we know that people who are infected are going to be breathing the virus out. So let's blow it away. So poor ventilation is a definite factor. Access to hand hygiene is apparently a factor as well, which, I mean, I don't know how much this is true, but if that's true, it would be appalling that in a meat processing plant there's limited access to hand hygiene. I don't know. But what I do know is that we do need good hand hygiene to stop the spread of this virus. We all know that, don't we? Workers who are foreign or migrants often live in dormitory-style residences. Now, this is a problem all around the world, actually. When people go away from home to work, this happens in Africa, it happens in Asia, it happens even in the UK to some. Well, it does happen in the UK. So, for example, people will come from Poland to the UK and they want to come here and make some money, which is understandable. They don't want to be spending money on rent. They want to make some money, go back home and spend that money with their family, of course. And especially a man on his own doesn't want a luxurious flat. He just wants to work. He might want to drink after work, then he just needs somewhere warm to sleep. He doesn't care if there's other guys there or not. It doesn't make any difference. So workers often live in crowded dormitory-style residences. Guaranteed spread. So they work in a crowded factory and then they sleep in a crowded dormitory-style residence. It's not a good combo, not a good combination at all. And they often take crowded vans and buses to work, again, to save money on transport. Because, you know, if 20 guys can get in a van, then they're not paying 20 lots of petrol or 20 lots of parking fees or whatever. It's simply cheaper. And apparently a lot of these workers live outside a town where there can be difficulty accessing fresh food as well. So that's quite concerning. And we know that good nutrition is important for maintaining the immune system. So I think interesting case study there from meatpacking plants in the United States. Things that everyone can learn, because what we try and do and talk about principles on this video, everyone can learn from that. Now, Senegal Senegal is in West Africa. Not too many cases, not too many deaths, but frustratingly, I couldn't find the amount of testing. But this was encouraging. Dr. Saul, the director of the Pasteur Institute in Senegal, has got experience working on Zika virus and Ebola virus. And they've developed a suitcase laboratory produced in the country. And they've exported these to other areas of Africa. And I understand that these are quite cheap. So what you would do is Dr. Saul and his team would make up this vaccine testing kit. You'd pick it up, take it to your country and test a few hundred people with it. A few thousand people with it, I don't know. So I really like that idea that in country they're producing a laboratory suitcase-based testing little laboratory in a suitcase. What a great idea. And Dr. Saul, who's knows about these things, did say it's important to contain diseases at source, as indeed Africa did with Ebola, as indeed China did not do with COVID-19. So simple. The virus comes up, contain it at source. What's hard to work out? China failed to do that. The World Health Organization failed to ensure that. It's past. We can't change it now, but sometimes the frustration does get to me. Yemen, war-torn countries, reported the first 2 deaths. So that's only going to get worse, unfortunately. The deaths means that the cases have been there for some time. And in the context of a war, it is not good news. Indonesia concerns me, increasing cases and increasing deaths. And we know these are grossly underreported. So I'm afraid there's going to be, the case fatality rate in Indonesia, the population there is huge. It could well be 1%, 1.5%. It's not good. Afghanistan has had the biggest daily rise of cases. So on Thursday, there was an extra 232 cases. And these, of course, are official. We know the real numbers are higher than this. 64 deaths. The lockdown in Afghanistan has been very patchy. Some parts of the country reasonable, other parts of the country non-existent. And my contacts tell me that most city streets are still crowded in Afghanistan. Now, just to finish today, I want to bring you a quick review of a paper. Now, this is a peer-reviewed paper, so I'm just going to go through it quickly. It's from Nature Medicine, so this is the Nature International Science Journal. This is their medicine section. Respiratory virus shedding in exhaled breath and the efficiency of masks. So they examined 246 cases. 111 were infected with human seasonal coronavirus and or influenza virus or rhinovirus. Now, what are these? Now, the coronavirus, the seasonal one, is a coronavirus, of course, but there's 4 coronaviruses that infect humans that cause common cold type features, as indeed does rhino. Rhino means to do with the nose, so rhinovirus is a virus you get in the nose. It's the one that causes cold. And influenza virus, mostly influenza type A virus. So people were infected with that or that or that. Coronavirus, influenza virus or rhinovirus. And 3 were co-infected. 3 were infected with more than one virus. So this is evidence that people can have coronavirus and another virus at the same time, which we already knew. Now, we tested viral shredding in nasal swabs, throat swabs, respiratory droplet samples and aerosol samples. So respiratory droplets, they were testing for viruses, and aerosols, from simply speaking, they were testing for viruses as well. Compared viruses in respiratory droplet samples and aerosol samples with or without masks. So what they're looking at here is the viral particles in aerosols and droplets in people wearing masks compared to people not wearing masks. Viral RNA was identified from respiratory droplets and aerosols for all 3 viruses. So they found coronavirus, influenza virus and rhinoviruses in aerosols from speaking, the small droplets, and in the bigger droplets, the larger droplets. So they found all 3 viruses in aerosols and in larger droplets. Coronavirus in respiratory droplets and aerosols in 4 of the 10 samples collected without masks. So what they looked for was coronavirus, and they examined the respiratory droplets that people with coronavirus were producing. This is the coronavirus that causes a cold, not the coronavirus that causes the COVID-19. And 40% of them were producing the virus in these water droplets they were breathing out. So interesting. The coronavirus type that causes a cold, 40% of people are breathing it out. But they did not detect any virus in the respiratory droplets or aerosols collected from participants wearing masks. So in other words, the people not wearing masks, 40% of them were breathing out and coughing out the virus, or the virus was coming out when they were talking. The ones that were wearing masks, they didn't collect any. So 40% more people shed the virus who don't wear masks compared to people that do wear masks. Remember, this is mask wearing to protect other people from the person wearing the mask. It's not people wearing a mask to protect themselves as you would in hospital. Our results indicate that aerosol transmission is a potential mode of transmission for coronavirus as well as influenza and rhinoviruses. So droplets and aerosols can transmit coronaviruses, influenza viruses and rhinoviruses. Simple scientific finding. We also demonstrate the efficiency of surgical masks that we're using. Now, you don't have to use surgical masks, as we looked at before. Any face covering will do. We also demonstrate the efficiency of surgical masks to reduce coronavirus detection and viral copies in large respiratory droplets and in aerosols. So we also demonstrated the efficiency of surgical masks to reduce coronavirus detection and viral copies in large respiratory droplets and aerosols. In other words, the masks were keeping the viruses, stopping the virus from spreading in aerosols and droplets. Masks are working. So, simple message, without masks, 40% of those infected with the virus were giving out the virus, the coronavirus that causes colds. With the masks, they didn't detect it in anyone. And then they humbly say this has implications. This has important implications for control of COVID-19, suggesting that surgical face masks can be used by ill people to reduce onward transmission. So what this is saying, and this is good science, is this is saying that wearing a mask, if an infected person wears a mask, they're going to protect those around about them very substantially. So why everyone's not doing this is a mystery to me. So everyone who is infected or thinks they could be infected should wear a mask. And if everyone wears a mask, then we're guaranteed to pick up all of those people, aren't we? So good scientific evidence that mask wearing protects people from COVID-19. And it's cheap. And of course, it doesn't have to be a surgical mask. Any face covering will do, as we've looked at numerous times on this video. Right, that's us for us today. Let's look at some of my excellent viewers now. Got a few to look at today. Let's go onto the right screen so you can see it. There we go. So this is Amjed watching in Turkey. Good that you're watching in Turkey. This is Anders and Kim in Las Vegas, sunny Arizona. Is it Arizona? It is Arizona, isn't it? I'm afraid this video's shown up my lack of geographical knowledge. Anyway, that's Las Vegas, out there in the desert. Who's this? Oh, that's Andrew in England with a very patriotic mask. Glad to see you've downloaded the same app as me, Andrew. Excellent. Take 1 minute each day to help fight the outbreak. So me and Andrew agree on that. And Andrew's just keeping an eye on his oxygen saturations, which is also something we suggested on this video. Thank you, Andrew. And I'm sure that's a homemade mask, isn't it? Excellent. So Andrew illustrates perfectly the point. We don't need a clever surgical mask. We just need a homemade face covering to protect those around us. This is Becky in the United States. Thank you for watching, Becky in the United States. This is Carla in Florida. I mean, look at that sunshine. I am envious. Carla, beautiful weather in Florida. Thank you for watching on your mobile device in Florida. Chris and Bridget in New Zealand. Now, I believe Chris and Bridget are actually English or British, and they got stuck in New Zealand when they couldn't travel home. But I don't think they're too worried about it, because I think they've got somewhere to stay, and New Zealand, of course, is much safer than the UK. And now look at this. This is Iran. Sorry, I'm pronouncing your name wrong here. New York. Now this shows the coronavirus looking in at what I'm doing. Let's hope the coronavirus is displeased. In fact, I think he might be, because the coronavirus doesn't look too happy, does he? So let's hope the coronavirus isn't very happy. But he's looking in through the window. Don't get the impression that coronavirus floats around in fresh air. It doesn't. It's inside that you're going to catch it. But a great illustration. This is Gemma. Gemma's on the Macca reservation, way up there in the tip of I don't know what you call the tip of it. It's right in the tip of Washington State. Gemma, Gemini. Sorry, Gemini in Washington State, and the reservation there. Excellent. Great to know you're watching in the reservation. Jean and Bernice from Brazil. It's just great the way people watch from around the world. Looks like Jean's wearing a mask because someone told her to, so thank you, Jean. Don't need it in the house, just when you go out. But it's an excellent way you're illustrating that, so we appreciate that, Jean. Thank you. Just blame me. I told you to wear masks. It's my fault. Georgie in Mexico. And we did look at Mexico in some detail yesterday, didn't we? Oh wow, look at this. This is Marcy in Florida. Now, I don't know if you can see, but over there, we'll go in a bit. Over there, that is Cape Canaveral. That is where the moon rockets took off from. Across the water in Florida at the Kennedy Space Center. Beautiful view. And, good to see you watching in Florida. All the way across to Cape Canaveral. Must be a tremendous view when the rockets take off, Marcy. You'll just see them going up there. It'd be fantastic. Oh, I thought we had more. We got more. Oh yeah. This is a homemade mask by Mark. So good. It may save my... Indeed, absolutely. You're protecting other people. So thanks for that, Mark. Michael in Australia sent this in. Another cat one. I don't think the cat's interested. I've got this down as Mr. Millet in the USA. Sorry I don't know your name, but I'm pleased you're watching. Thank you for watching. This is Paul. Oh yeah, Paul's watching over here. The sun's come out on my screen, I can't see it. Yeah. Can't quite remember where you are, Paul. Sorry about that. This is Sophia from Leicestershire, sending some love via the internet, which of course is great. We all need all the love we can get. So thank you for that, Sophia. This is Trevor from Maine. Beautiful state of Maine up there in the top right hand side, isn't it? In the United States. So thank you for everyone for sending pictures in, and thank you very much for watching.